Irregular periods are a common experience for many people who menstruate, and they can happen for a variety of reasons. While the menstrual cycle is often described as a predictable 28-day pattern, the reality is that for many, periods can come early, late, or at unpredictable intervals. Understanding what causes irregular periods, when it's considered normal, and when to seek medical advice is important for anyone looking to take charge of their reproductive health. A typical menstrual cycle lasts from 21 to 35 days, with periods lasting anywhere from 2 to 7 days. However, factors ranging from age to lifestyle to underlying medical conditions can cause cycles to become irregular. For some, this might mean periods that come more or less frequently than average, bleeding that is heavier or lighter than usual, or even missed periods altogether. Let's start with some of the most common causes of irregular periods. One of the primary factors is hormonal imbalance. Hormones like estrogen and progesterone regulate the menstrual cycle, and disruptions in their levels can impact ovulation and menstruation. During puberty, for example, it's normal for cycles to be irregular as the body adjusts to changing hormone levels. Similarly, perimenopause, the transition to menopause, can cause cycles to become erratic as hormone production fluctuates. Stress is another significant factor. Physical or emotional stress can disrupt the delicate balance of reproductive hormones. When the body perceives stress, it produces more cortisol, a hormone that can interfere with the normal production of estrogen and progesterone. This can delay ovulation, resulting in missed or late periods. Changes in weight and diet also play a role. Rapid weight loss or gain, restrictive diets, or eating disorders such as anorexia or bulimia can impact hormone production and menstrual regularity. The body requires a certain amount of body fat and nutrient intake to maintain normal reproductive function. When those needs aren't met, periods can become irregular or stop altogether, a condition known as amenorrhea. Intense physical activity, especially when combined with low body fat, can also disrupt periods. Athletes, dancers, and those who engage in strenuous exercise may experience irregular cycles or missed periods. This is sometimes referred to as the female athlete triad, a condition characterized by energy deficiency, menstrual disturbances, and decreased bone density. Another common cause of irregular periods is polycystic ovary syndrome, or PCOS. This hormonal disorder affects up to 1 in 10 women of reproductive age and is characterized by irregular cycles, excess androgen levels, and ovarian cysts. PCOS can lead to infrequent, prolonged, or missed periods and may also cause symptoms like acne, weight gain, and excessive hair growth. Thyroid disorders are another potential culprit. Both hypothyroidism, an underactive thyroid, and hyperthyroidism, an overactive thyroid, can disrupt the menstrual cycle. The thyroid produces hormones that help regulate metabolism and interact with reproductive hormones, so any imbalance can lead to changes in period frequency and flow. Certain medications can also affect menstrual cycles. Hormonal birth control, such as the pill, patch, or hormonal IUD, can cause lighter periods, skipped periods, or, in some cases, stop periods altogether. Other medications, such as antidepressants, antipsychotics, chemotherapy drugs, and even some allergy medications, may also impact the menstrual cycle as a side effect. Chronic health conditions, including diabetes and celiac disease, can influence menstrual regularity as well. Poorly controlled blood sugar in diabetes can interfere with hormone levels, while celiac disease, an autoimmune condition triggered by gluten, can cause inflammation and nutrient malabsorption, impacting reproductive health. Less commonly, structural issues such as uterine polyps or fibroids, non-cancerous growths in the uterus, can cause abnormal bleeding or irregular periods. In rare cases, cancers of the reproductive organs can also present with changes in menstrual patterns. It's important to remember that occasional irregular periods are often nothing to worry about. Many people experience cycle changes from time to time, especially during times of stress or transition. However, there are times when irregular periods warrant further attention. So, when should you be concerned? If you are under 45 and your periods stop for more than 3 months, and you are not pregnant, breastfeeding, or going through menopause, it's a good idea to speak to a healthcare provider. Likewise, if your cycles suddenly become very irregular after years of consistency, or if you experience very heavy bleeding, such as soaking through a pad or tampon every hour for several hours, or passing large blood clots, it's worth seeking medical advice. Other reasons to consult a healthcare professional include periods that last longer than 7 days, periods that come more frequently than every 21 days or less frequently than every 35 days, or if you experience severe pain, fever, or symptoms of anemia such as fatigue and shortness of breath. Unexplained weight changes, excessive hair growth, acne, or signs of a thyroid disorder, such as changes in weight, energy levels, or temperature sensitivity, are also reasons to get checked out. For those trying to become pregnant, irregular periods can make it more difficult to predict ovulation and conceive. If you've been trying to get pregnant for a year or more without success, or 6 months if you're over 35, it's a good idea to talk to a fertility specialist. Treatment for irregular periods depends on the underlying cause. For some, lifestyle changes such as managing stress, maintaining a healthy weight, eating a balanced diet, and moderating exercise intensity can help restore regular cycles. If a medical condition like PCOS or a thyroid disorder is at play, treating that condition can improve menstrual regularity. In some cases, hormonal medications such as birth control pills or hormone therapy may be recommended to regulate periods. Tracking your menstrual cycle, whether with a calendar, an app, or a simple notebook, can be a helpful way to notice patterns and identify changes. Note the first day of each period, how long it lasts, the amount of bleeding, and any accompanying symptoms. This information can be invaluable when discussing your cycle with a healthcare provider. In summary, irregular periods can stem from a wide range of causes, many of which are benign and temporary. However, persistent changes or accompanying symptoms should not be ignored. Listening to your body, keeping track of your cycles, and seeking medical advice when something feels off are all important steps in maintaining reproductive health. Remember, you know your body best, and taking charge of your menstrual health is an important part of overall well-being.